Hello, hello, and welcome to our monthly wisdom medicine webinar. We are so excited to be here today to celebrate the endometriosis a month of March. And I'm here with the lovely Leah Barack, one of our functional nutritionists on the team. My name is Frankie Shelton. I'm the co-founder of Wisdom Medicine, and this is a special treat for me to get to be here with everyone today. So I am excited to dive into this topic of endometriosis. Endometriosis affects 10% of reproductive age women. That's 1 in every 10 women. So just think about your girlfriends, think about the women in your life. 1 in every 10 women are experiencing or maybe have a undiagnosed case of endometriosis. So 1 in 10, 10% of women. And the symptoms vary from chronic pelvic pain to infertility and many, many more symptoms that can be underlying or kind of come up throughout a woman's hormonal lifetime. So we're excited to be able to be here today to discuss all of the best strategies, including dietary and lifestyle strategies for managing endometriosis, including foods and lifestyle tweaks and changes and habits that can help us to reduce symptoms. So there's so much that we can do when it comes to endometriosis. So I am so excited to dive in. Leah, I want to get started just in kind of laying the stage and kind of setting a frame for everybody. If you're new to the topic of endometriosis, or if you yourself have symptoms and you're curious about it, wherever you may be, could you give us just a bit of a rundown in terms of how you define what is endometriosis and maybe a bit about what it would look like, feel like in the daily?
Totally. Thanks so much, Frankie. Excited to be here with you and talk about this important topic because I think a lot of people don't realize just how many women it does affect. And interestingly, like that 10% is that low end of the spectrum. It's very likely more women actually, because they might not be getting diagnosed, like you said. So it could even be more than that 1 in 10. So it's really important that we understand this. And so what endometriosis is it's a chronic condition where tissue that's very similar to the lining of the uterus, which is called the endometrium, basically grows outside of the uterine cavity. So this could mean that it's growing on your ovaries or your fallopian tubes or the outer surface of the uterus. Or the pelvic organs, anything like that. And so with endometriosis, this tissue responds to hormones, much like your regular endometrium does. But it's actually more of an immune condition or an immune disorder than a hormone disorder. So it responds to hormones, but we really want to look at the immune system when it comes to endometriosis, which we'll talk about later on when we talk about food and that kind of thing. But in terms of what you might experience if you have endometriosis, is every menstrual cycle, the tissue is going to respond to those hormonal fluctuations. So our hormones are changing throughout our cycle, especially in the second half of the cycle when many women might experience PMS symptoms. But this can lead to things like inflammation, really severe pain, and even the formation of scar tissue, which can affect fertility. So you can have painful, really heavy bleeding in your periods. Like I said, infertility is something that many women with endo struggle with. Even things like pain during intercourse is another one that many women struggle with. And then things like fatigue and digestive issues, lower back pain. These are all things that you might experience if you have endo. And so I like to just remind people that like this debilitating pain, if you have so much pain that you are basically sidelined or you have to pop painkillers every cycle, that is not normal. So I know as women, it's often like, suck it up, you're a woman. This is just part of, having a period, having cycles, and that's not actually true. So like if your doctor is saying that to you and they're not really listening to your symptoms, then it's time to find a doctor who will listen, because popping those painkillers to just like function is not actually normal. So that's kind of an overview of what endo is and some of those signs and symptoms that you might experience if you have it or you have someone in your life who has it, so you can kind of better understand it too.
Great. Thank you so much for setting the stage for us. And what I think is interesting about endometriosis too is that we have this kind of idea, like you said, that it like lives in the hormonal system, right? That it's like it is a women's issue. It is a hormonal based issue. Over the years, I've heard, relationship spoken about estrogen's relationship to endometriosis. And so I think we do really tend to frame it as just a hormonal issue. But in terms of the immune system and maybe some other kind of integrated ways of thinking about endometriosis, what are the factors that are really important to address if we think we might have endo or if we have already gotten that diagnosis?
Yeah, totally. And like you, kind of before I really dove into this, same thing. It's like if someone has endo, they go to the gynecologist, they have their hormones, looked at, and that's kind of it. And the conversation ends there, which is what's so beautiful about functional medicine and naturopathic medicine is we really look at the whole body and we look at all these systems that are really playing into it. So the immune health is absolutely essential to look at. So looking at endo more through the lens of immune activation or immune dysfunction with kind of like a secondary hormonal component is how I like to look at it. So it kind of acts more like an autoimmune disorder than a hormone disorder. It's not currently classified as such. It may down the line be classified as an autoimmune disorder. There's a lot of like back and forth with that. But that inflammation and the role of the immune system is absolutely key. So we really want to look at managing that inflammation. And that's where a lot of that pain and those symptoms come from as well. So that's kind of like the first factor that we really want to look at. Another one is gut health. So this is a really big one. Also ties into immune health because most
Mhm.
of our immune system is actually in the gut, which a lot of people don't realize. About 70% is in the gut. But things like bacterial endotoxins, which are basically like toxins that your body makes, those are like lipopolysaccharides or LPS, and that might play a role in triggering some of that immune dysfunction as well. So that's something that you want to take into consideration. And again, the gut health aspect is something that I find a lot of like Western medicine is missing when it comes to treating endo, and it makes such a big difference. SIBO, or small intestinal bacterial overgrowth, is a condition that's been really linked to endometriosis, and it can exacerbate symptoms. So this is basically like where your bacteria that should be in the large intestine moves up into the small intestine, and that can trigger some issues. So treating that is definitely a factor that's part of treating endo. So doing stool testing or SIBO testing or something like that with your doctor can be really helpful as well. Also, leaky gut when it comes to gut health is really important to address as well, because that can also trigger inflammation. So if your gut is kind of like leaky, basically those cells lining your intestines open up a little bit, and then they allow things to come through that are too large or that shouldn't be coming through, and then the immune system kind of mounts an attack. So we want to decrease all of those factors because inflammation, as we know, is a huge part of it. So the gut health is one factor. And then we do have to address hormone health. So it's not that this isn't a hormonal factor, it definitely is. So estrogens, as you mentioned, we still want to avoid things like estrogen dominance. We want to think about increasing progesterone in the second half of that cycle, which can kind of help offset some of those symptoms that having too much estrogen can create. And so estrogen also is going to stimulate those lesions. So we need to make sure
Mhm.
estrogen's in check. And then the other things that we want to consider are in regards to kind of like hormone health are all of those things that affect hormone health. So things like blood sugar, which a few months ago we did our talk on blood sugar and we talked more about that. So I won't dive super into that, but blood sugar, making sure your meals are balanced, also detoxification. So helping to actually get those excess estrogens out of the body is really important. And then stress is also kind of like really important, maybe the number one most important thing when it comes to hormonal imbalances. So those are some of the other factors that we want to look at when we're treating endo.
So it really is a truly a whole body approach that is needed, it sounds like. And I think that when we realize that hormones also don't just live on their own island, but that they're interplaying with these other systems of the body, we start to see this really close intersection, especially to highlight what you said about the digestive system and the hormonal system. You know, there is this crossover that we see so often at wisdom medicine, is that if someone, it's so rare that someone has a hormonal condition without a digestive issue, or vice versa, a digestive issue without a hormonal issue to it, right? Or an element to it, or like you said, like a secondary factor. And I think that the sooner women kind of tie those two symptoms together, we're able to unlock and really uplift the immune system because of that, right? So without having these things that are weighing down the digestive system or weighing down the hormonal system from being able to optimally function, then we're able to actually like kind of give new life to the immune system, be able to thrive as well. So I love how you laid that out. I think that too, with when we think about the classification of autoimmune disease, it's a really interesting question that you lay out. I think that there's a lot of things that we'll see change their classification over time. We've already seen that happen with so many chronic conditions. And we know that women experience autoimmunity at a much higher rate than men do as well. And there is that hormonal triggering element of autoimmune disease. So whereas we may see more women develop an autoimmune condition after the birth of a child, during puberty, or during menopause because of these big hormonal fluctuations. Same things with endometriosis. But to me, from what I've seen clinically, it seems that endometriosis seems to be one that happens earlier in a woman's life. Like usually it's something that women have always struggled with, puberty, heavy periods, but just have gone so many years without being able to get a solution for them.
Yeah, totally. You hit the nail on the head completely. And I think, and I know you do a lot of this with your own work as well, but in terms of like research studies on women, research studies on women's issues, we are lacking completely. So even in terms of like endo, like we don't have that much data, unfortunately, because we don't have that much funding. So hopefully, that's something that changes. And I know you're a pioneer in that field, which is amazing, but definitely, hopefully we'll get more answers in the next few years as well.
So while we're waiting for everything to catch up, what are some of the foods that we should be paying attention to and potentially kind of decreasing in the diet if we're worried about endo being an issue for us?
Yeah, so this is a big one. So anytime I talk about kind of like avoiding foods or pulling foods out of the diet, I always like people to first just be conscious of their relationship with food first. So like any history of disordered eating, that kind of thing, we want to take that into consideration first because endo can be really scary, right? Like it can feel really scary. And then, there's all these blogs and Reddits and books and all these things on like all the foods that are horrible, don't eat them, that kind of thing. And it can be a lot of fear mongering. So I'm going to share some of those foods that have been shown to be helpful in reducing if you have endo, but we always want to remember too, like if it stresses us out more, avoiding these foods, or we feel like it's becoming just too much anxiety or that kind of thing, we want to take that into consideration and maybe work more closely with a practitioner that's, experienced in disordered eating. That being said, there are certain things that can be helpful. So like we said, with endo being very similar to an autoimmune disease, it actually responds similarly to some of those autoimmune interventions that work really well for people. So first and foremost is gluten. So gluten can contribute to some of that intestinal permeability that we talked about before, just overall inflammation in the body. So many women with endo do experience positive benefits from decreasing gluten. So this would be like bread, pasta, a lot of processed foods have gluten, and we should kind of be decreasing those foods anyways, which we'll talk about in a minute. But keeping an eye on gluten would be one. Another one to consider would be A1 casein in dairy. So dairy, it can be divided into A1 and A2. And so A1 is kind of like all your standard regular dairy that you see at the grocery store, cheese, milk, yogurt, that kind of thing. And this can increase inflammation in some individuals, can increase estrogen as well. So sometimes women experience relief if they switch to A2 dairy, which comes from goat, sheep, buffalo, and a specific breed of cow. You'll see on the label, it will say like A2/A2 milk or cream or whatever it is becoming more popular because it tends to be easier on digestion and less inflammatory. So I always like people to do like a little bit of a investigation, a little bit of detective work, trial and error to see if this is actually a factor for them. But it can be really helpful for people to either decrease dairy entirely or just decrease A1 dairy and stick with just A2 dairy. So that's another one that some women experience symptom relief with as well. Another one is sometimes eggs. So this is about 1 in 3 women. I don't recommend taking eggs out just willy-nilly because eggs are so nutrient dense. I call them like nature's multivitamin. They have so many benefits. But for some people, it can trigger some immune response. Now, this doesn't mean that after you do like a gut healing protocol and your gut feels a lot better, that you might not be able to reintroduce. That's kind of the goal, is to be able to get those back in. But if you're experiencing like really bad symptomology and you've tried decreasing gluten, decreasing dairy, haven't really seen a difference, it might be worth just trying it out and seeing how you feel without the eggs. In terms of other things to kind of like limit or avoid, we want to think about, again, the immune system. So what are things that increase inflammation? So things like refined sugars. So added sugars. I'm not talking about fruit here. I know a lot of like the endo blogs and that kind of thing online are like, don't eat any fruit. I do not believe in that. I think fruit has a lot of benefits, whole fruits, but we want to think about added sugars because those can increase inflammation in the body, cause blood sugar dysregulation, all of those things we want to avoid. Alcohol is a really big one. So this disrupts almost everything in the body, honestly. It's going to disrupt sleep, gut health, inflammation, contribute to estrogen excess. So definitely decreasing or avoiding alcohol is something you want to consider if you have endo. And then thinking about your fats. So decreasing like fried foods or excess omega-6 fats. So these are like seed oils, soy oil, peanut oil, safflower, sunflower oil. A lot of these, again, are in those processed foods. So if you're primarily cooking your own foods with good fats, good oils, it shouldn't be as much of a problem. But just in general, thinking about kind of decreasing those hyper processed foods in general, or any foods that your specific body doesn't respond well to. So if you have specific food sensitivities, you might want to temporarily pull those foods out. And so all of this should really be based on, symptoms, trial and error. If you avoid these things and you don't notice any difference in like 3 to 6 months, then think about adding them back in, like I said, with the eggs and those other ones that are more nutrient dense. So it's a little bit of like case by case and trial and error with those.
Yes, and I love that you pointed out the A2 options with dairy too, because I think that I've seen that so much in clinical practice for just still being able to have that variety. Like I think that that's something that's so important and often gets missed when we've been on a health journey and we've been removing foods, and sometimes it feels like that list can just keep getting longer and longer, which, like you said, can add to stress. But when we have the options that we can still maybe have dairy in our life, but choose different dairy, or have sweetness in our life, but be able to choose, the sweetness that we get from fruits or from certain grains or things like that, just so that we continue to diversify the diet, I think it's stress reducing in itself. So sometimes just kind of like holding both of these philosophies at the same time, that there are certain foods that may be triggering, but there also is a need for continuing to diversify. So kind of as a way of doing that, always asking yourself, if you're removing a food, what can you add in or add more into your diet? And I know that that's something I'm curious about here, is as we're looking at the foods to avoid, are there certain foods that we want to make sure to increase or incorporate in order to, one, diversify, but also to make sure that we still have a full and robust and nutrient dense diet?
Totally. And I love all of what you're saying too, because I also like to remind people that there's different nutrients in all the foods we're eating. So once you start to decrease those foods, you're decreasing those specific nutrients that are in those foods, like the eggs and the dairy and that kind of thing. And then the second piece of that as well is the gut microbiome. So the best thing that you can do for gut health is really increase the diversity of foods you're eating. So I find when people start to decrease, pull out all these foods, then their gut health actually ends up suffering in the long term. So that's not actually what we want to do long term. Like I have people ask me, oh, I just got diagnosed with endo. Like, should I go on the low FODMAP diet, like right off the bat? And I'm like, no, we don't, we want those foods in. Like that's not meant to actually solve the issue. It can be helpful for like very short term symptom management, but it's definitely not something that you should be on long term. So we want to always be focusing on what we can add in. So in terms of like an endo friendly diet, thinking about like high level overview, focusing on whole food anti-inflammatory diet. So that's really what we want to have our focus on. I always like people to really focus on eating the rainbow. So with this, I'm talking about like fruits and vegetables, that kind of thing. Like I said, some people will say don't eat any fruits. I disagree with that. Fruits and vegetables in their whole food form are anti-inflammatory. They decrease oxidative stress. They're great for that gut health, like I was talking about in terms of the fibers. So we want to kind of think about eating the whole rainbow every single day. So this means hitting every single color that's in the rainbow, like literally in your fruits and vegetables that you're eating. Because all of those different colors, like we were talking about, have different nutrients that we want to add in. Herbs and spices I love. So I actually call these nature's medicine cabinet. They're incredibly powerful. They're anti-inflammatory. They have antioxidant properties. They give taste to food, right? We still want to be enjoying our food as well. Things like turmeric and ginger can be really powerful also, especially if you're dealing with any kind of like pain, inflammation, especially around your period or right before. Those can be really helpful. Healthy fat. So olive oil is a big one. This is a hallmark of the Mediterranean diet and for good reason. Fatty fish. So this is a big one. So salmon, mackerel, anchovies, sardine, herring, all of these are really helpful. They're very high in omega-3 fats and also have healthy proteins. And speaking of proteins, we want to make sure we have enough protein. So this is for blood sugar balance, for hormone balance, for helping with stress, for helping with mood, all of those things as well. So making sure you're getting a healthy protein in at every meal. And then just in general, fiber. So this will kind of depend, right? Like if you do have SIBO and you're struggling with a lot of gut issues, you might need kind of a different plan than someone else who's not. But in general, fiber and different types of fiber. So this is anything from plant foods. So whole grains, legumes, nuts and seeds, vegetables, fruits, all of these are great to add in to kind of help feed that microbiome. And then fermented foods. So again, depending on your current status, if you have SIBO or something like that, it might be a little bit different. But in general, most people would benefit from fermented foods for the gut. So this is like sauerkraut, kimchi, and unsweetened kefir. Again, if you can tolerate dairy, they do have A2 kefir. So like goat milk, sheep milk, that kind of thing too. Those have those live bacteria that can be really helpful as well. And then other things I like are flax seeds. So these can help manage estrogen levels. So getting like a tablespoon of flaxen every day can be really helpful. Cruciferous veggies. So this is like broccoli, cauliflower, kale, bok choy. All of those contain something called indole-3 carbinol, which basically helps the liver to detox excess estrogen, and just helps regulate those hormone levels as well. And then lastly, thinking about magnesium rich foods. So most people aren't getting enough magnesium in their diets. And so thinking about green leafy veggies, nuts, seeds, legumes, even like dark chocolate in moderation has magnesium as well. So those are some ideas of things that you can start to include in your diet as we're talking about. So not just focusing on what to exclude, but focusing on what you can include to help bring your body kind of back into balance and help support immune and hormone health.
Wonderful. You made me hungry just hearing all of those foods.
It sounds good, doesn't it?
It does. It does. And I think that that's the power, in terms of like thinking about food is this way. And even though, it's been said so many times that food is really our medicine and that food is really has such a potential in terms of how we work with it and how we pay attention to it. It's so true when it comes to something like endometriosis. And I think that in some ways, there's patterns with different chronic conditions. And I think with endometriosis, what I've seen over the years is that there is like a a real difficulty in coming to terms with why your body is working against you. Like whenever we have even painful periods can bring this on for people where it can become this frustration. It can become this thing where, I feel like I'm doing all the right things, but every month I have to face this kind of beast of a cycle that's coming on and all the symptoms that come along with it. And I think that there is a real mindset shift with endometriosis that has to happen of really kind of like becoming in step with your body, right? Becoming in a conversation with your body, listening to these signs and symptoms of how we react to foods and giving ourselves the ability to hear what our body has to say about it. Because there is, as Leah and I have both seen, from years of being nutritionists, it's amazing the revolution that can happen in the body when it's given the foods that are right for you. And it is going to be different for everyone. It is going to be a unique journey. And part of that is just being able to craft that conversation with your body. Okay, I eat this. These symptoms are worse, or vice versa. I feel better when I'm having these types of more foods in my diet. And how do I commit to that? I think the thing that I will highlight though about endometriosis is that depending on how long you've had these symptoms or maybe an underlying diagnosis, for some women that could be as long as 8 to 10 years before they're able to get a diagnosis from a doctor. There could be things that have already taken place, that scarring that Leah spoke about, that those things that are there that may need to be dealt with. And that doesn't mean, though, that there isn't always like a step you can take in this direction of diet and lifestyle that can help to alleviate some of that ongoing condition from continuing. And I think that there's like both of those things happen with endometriosis, where especially if there has been long time of dealing with this, there may be a need to speak to a specialist. There may be a need to speak to a doctor who can refer you to a specialist that is going to be able to really support kind of this like physical issue of endometriosis and these things that we can do in terms of diet and lifestyle as well. So it is a multifaceted condition and is a complex one, as Leah's laid out for us. So in terms of lifestyle and things that we think of with endometriosis, I'll never forget years ago working on a program for Endo, and I got introduced to the idea of the spoons. Do you know about the spoons,
No, what is
Leah?
that? No, I'm so
Well,
curious.
I think it's used in other, in other ways, but some people are like, I've used all my spoons for the day. Like this idea that we have to, with endometriosis, really pay attention to our energy levels, and that because stress has such an impact on endometriosis, that if you've used kind of like all of your spoons or all of your energy, like either caring for others or with a busy work day, to be very mindful of like how to recharge or how to regenerate. And that, there's a special way of really paying attention to that, I think, with people with endometriosis, that we don't need to do more oftentimes. Like we need to know where we can reel it in or know where we can peel back some of those commitments or layers that we have that are kind of using up our energy source. So it made me think about that when we were talking, when I wanted to ask about lifestyle. But that's one thing I learned from somebody with endo is how they framed it or how they talked about it.
Yeah, no, I love that because it's so true. And I think especially as women, we're always giving to everyone else first, right? And going above and beyond and all of these things. And so it can feel really hard to do less. It can actually feel harder than it feels to do more, right? Because a lot of us, that's kind of like our coping mechanism. But stress management and kind of tuning into your own energy levels is totally imperative, because if you're just pushing, pushing, pushing all the time, your body's not going to be able to heal. So the body can only heal if you're actually able to rest and stimulate, your parasympathetic nervous system. So that's one of the lifestyle factors that I wanted to mention, is that stress management. So that's going to look different for everyone, but I mean, stress affects, again, your immune system. So stress alone can increase inflammation and immune dysfunction. So maybe for you, that looks like yoga or breath work or taking a bath or doing a mindfulness practice or journaling or doing a gratitude practice. Like, it's going to look different for everyone, but really trying to make that part of your daily routine. So not just something that you do like, oh, when you remember it once every 2 months and you have a few minutes, like really prioritizing it, because it is so important. So stress is one part, and then adequate sleep. So this is absolutely essential. A lot of people are really sleep deprived. So we really want to focus on this, especially knowing that fatigue can come from endo, right? Like, we do already have lower energy levels. So we also really want to prioritize sleep. And that's a lot of when that rest and repair can happen as well. Other things that can be helpful, I found really helpful for endo, are things like acupuncture, which also is helpful, again, for stress, even improving sleep, but just for whole body wellness. I found a lot of women do really well with acupuncture. And again, it's one of those healing practices where you can kind of like be passive, right? You're kind of like required to just like lay down and not do anything. And that's great, because that's what a lot of women need, is kind of to just lay down and chill. So I also love it for that as well. Other things are like castor oil packs, which can be helpful. So this is just putting castor oil over your reproductive organs, ideally, and then kind of putting a heating pad over them. You can, look up how to do this online if you want to see a visual, but it can be really helpful for detoxification, just decreasing inflammation in the area as well, and decreasing pain. So castor oil packs might be something you want to add in. Also very passive. You have to like lay down while it's happening. So I like it for that as well. And then thinking about kind of just like reducing endocrine disruptors. So this could be things in personal care products, cooking utensils, cooking pans, cleaning products, anything plastic, like trying to kind of decrease your use of plastics and that kind of thing for overall hormone health. Movement is a really big one. So really trying to get some blood flow. It helps with inflammation, helps with gut health, with stress. However, one thing I will say is we don't want to overdo it with movement. So doing enough movement, but not overdoing it and doing too much. So kind of finding that happy medium there as well. So those are some of my kind of top lifestyle practices that I would recommend for anyone with endo.
Wonderful. Yeah, I think that, whenever we think of pain and period pain, and this may be, for somebody who's just kind of experiencing either early stage endo or just experiencing heavy periods, pain with cycles is so often correlated with stagnation, right? Like this stagnation that kind of builds in the body. And one of the early signs that you might want to think about when you're thinking about like, is this endo, is this painful periods, is this a, kind of a am I tracking in that direction, is asking yourself like that those different like self-care methods, like does applying pressure, does applying a heating pad, does applying, doing a castor oil pack, those types of things, like that is a clear sign that like stagnation, like there's that blood flow needs to move. And so I would say that one of the things for endo that I really like to recommend is like gentle movement. Like it doesn't have to be, like you said, like overdoing it, but gentle movement like yoga or dancing or like, things that involve twisting, things that involve kind of like a contracting and expansion can be so useful for getting the blood flow going. Like even just like little things like cat and cow and circling the hips, like there's so much in terms of bringing blood flow, getting blood flow moving that helps with that stagnation and that pain. But I bring it up because I think that when we're in pain, oftentimes we kind of want to like curl up and curl in, you know, and you want to like get in the bed and just not move. And that's a very natural response. But I think like just to bring awareness to the fact that movement is helping to stimulate that blood flow and helping to get us out of that stagnation. So even if you add just a little bit of it, it can be really helpful.
Totally. Yeah. Even just like going for a 10-minute walk outside can make such a difference. And like you said, it's usually the last thing you want to do, but it can be so, so, so helpful.
Absolutely. All right. Well, thank you guys so much for watching and for being here with us. This has been an amazing gift to the community, Leah. Thank you so much for all that you've shared and for all of the wisdom that you bring to the members at Wisdom and to everybody in the community that's here watching, whether you're live or whether you're watching this on replay. I do want to just give a quick heads up that anybody who's watching today and who's interested in, you know, continuing personalized support, please do reach out to us at Wisdom Medicine. We are here to help. This is the work that we're here to do. We're here to help women get the care that they need for these types of health concerns, including endometriosis, but anything else that is in this realm of digestion, hormonal health is really where our expertise is. In terms of the steps that you can take to join the Wisdom Medicine community, you can book a free consultation. We're here to talk to you at any time. Our onboarding team is able to get in touch, be able to see what it is you're going through, have a discussion, have a conversation, see what's worked, what hasn't worked. And so we're always happy to be able to answer questions and see if we might be a good match for what you're looking for. It's always also our exciting pleasure to be able to offer these types of conversations every month. And so when we have that next topic for April, we'll be sending that out through our email list. So make sure that you've signed up for our newsletter. And we have a conversation that we plan every month with one of our providers so that we can make sure to continue to raise awareness. I mean, I think it's kind of interesting to say that we celebrate Endometriosis Month, but what we're really celebrating is like these opportunities to come together and raise awareness about things that maybe don't often get talked about as much as they should. So please do let us know if there's topics that you're curious, interested in, that you haven't feel like you've gotten information on that you would like to. We're always open to those suggestions as well. So if you have any questions at all from today's topic, we would love to hear from you. You can always reach us through email at info@wisdommedicine.com. And thank you again, Leah, for everything. It was so nice to get to spend this time with you.
Thank you, Frankie. It was such a pleasure.
All right, we'll see you guys soon. Thank
Bye,
you.
everyone.